All right. Thank you guys so much for joining. My name is Katie. I am the Director of Programs and Operations for the Arkansas chapter of the American Academy of Pediatrics. And we are the membership organization for pediatricians in Arkansas. We provide a lot of continuing education and training for pediatricians and nurses and clinic staff, but we also want to serve as a resource for parents and for youth for quality, informative health, information and resources. And so um, we are here today because we have a grant through the National American Academy of Pediatrics called Healthy People 2030, which is a government benchmark every decade they have. And so ours was focused on youth and social media and pediatrics and how we can use social media as a sort of educational tool. It's not always bad. There are some positives. And so we have been working with a group of 5 high school students who have researched topics that their peers are interested in, like nutrition and exercise and sleep, to make social media content for their peers. So that way, if they're scrolling, at least they can get a little bit of helpful information and insight into their health. But we also do want to educate parents like yourselves on the negatives and the sort of reality of social media and being online. And so we're joined today by Dr. Joe Thompson, who is the president emeritus of the Arkansas Center for Health Improvement. He is also a professor of medicine and public health at the University of Arkansas for Medical Sciences and a member of the National Academy of Medicine, where he works to expand data availability for research to guide policy decisions across the nation. Dr. Thompson has played an integral role in the development of key health policies and programs in Arkansas, including the Arkansas Tobacco Settlement Act, the Clean Indoor Air Act, and the statewide trauma system. He served as Arkansas's inaugural Surgeon General from 2005 to 2015 in the administrations of Governors Mike Huckabee and Mike Beebe. And Dr. Thompson was also the U.S. Agency for Healthcare Research and Quality's first child and adolescent health scholar. He has also received numerous national awards, including a Lifetime Achievement Award from the National Network of Public Health Institutes and the National American Academy of Pediatrics. So we are very grateful to have him here today and have his expertise in Arkansas. And with that, I will hand it over to you, Dr. Thompson.
Well, Katie, thank you very much for that introduction. You left out probably the two most important things. I'm a pediatrician and a parent of two now adult children that have survived the process. So thank you for having me on. Thanks to all of you for joining us this afternoon. What I hope to do is to engage you and provide you some information around the safety and the opportunities for parents take a more active role in guiding their children's understanding of the benefits, but most importantly, the risks associated with social media use. We'll touch on our Arkansas Center for Health Improvement. We'll talk about some of the factoids that you have probably heard in the news. We'll talk some about the way communication styles are different in our new online age as opposed to in our in-person time. We'll touch on just a couple of three research projects, and then we'll talk about what parents can do, families can do, teens can do to help make sure that they're in a safe space. So I look forward to it. We'll go through and we'll have some question opportunities at the end. Our Arkansas Center for Health Improvement has been around a little over 25 years to try to bring the research and the policy together to make good decisions for Arkansans and their decision makers. We're a health policy center and try to turn data into information to help both public and private decision makers, and in this venue, parents who are decision makers on behalf of their families. Our mission has been a catalyst to improve the health of all Arkansans. Our vision is to be a leader that help people make better choices. And our values of trust, innovation, initiative, and commitment, I think, have led to some of the changes that Katie mentioned earlier in my introduction. We focused on our health care system, but also the communities within which we live, work, and play each day, and also the individual choices we make that have a direct impact on our long-term health outcomes and our quality of life. In the last 25 years, we've had the introduction of a new digital mode when ACI got started, there was not such a thing really as a internet communicating cell phone. That first occurred in 2007 with the introduction of the iPhone. The Android, paralleled the development process. But I want people just to stop and think for a moment. It was 2009 before you could first record a video in your handheld cell phone. It was 2010 before you actually had a camera that you could look into and record a video on FaceTime. So it's just been the last decade and a half that these new opportunities, new mechanisms, new abilities to communicate have been introduced. Also, with that introduction of the cell phone in 2007 came an open gateway where you now had complete access to the whole internet in your hand. And many of us as adults did not have this experience or exposure anticipated. And suddenly it was in our environment, it was in our kids' environment, and we had to figure out how we were going to manage this. As with most technology, younger folks move with it faster than older folks. And so we now have some challenges facing us moving forward. Some of the factoids that have been reported and that we've collected is 95% of teens report using social media, with almost a third saying that they're on it almost constantly. 40% of kids, 8 to 12, have a presence on a social media platform somewhere. Eighth grade kids spend an average of about 3.5 hours on social media daily. And 1 in 3 kids report using it until midnight or later in a typical weekday during school time. 64% say that they are often, sometimes exposed to hate-based social media content. Um, Nearly 60% of girls say they've been contacted by strangers on social media that made them feel uncomfortable. And almost half of Arkansas high school seniors report depressive feelings or feelings of sadness during the 2019 or 20 year. Now, this was during the pandemic, but again, our kids turn to social media as a way of communication without necessarily recognizing some of the threats and some of the risks that those represented. So we've got now a generation of teens for which social media, communicating through their cell phone, is a standard way of daily living. We've got parents that don't necessarily understand that this is a gateway to the entire internet, both the benefits and the risks thereof. And it actually is having an impact on our teens' ability to communicate. And that's what I want to focus on next is the different way that this communication style is compared to that with which we have historically used. This is from a book, Jonathan Haidt, The Anxious Generation. I would recommend it for parents if they want to really uh, uh, delve into some of the changes. In the real world of communication, this is that with which you might have a conversation with your friend. It's synchronous conversation. It's a back and forth exchange of information. It is an embodied form of communication. You have both verbal and nonverbal cues. And usually it's in a one-to-one relationship or one to several. You and your friend, you and a small group of people that you have a relationship with. And those relationships have a high value. There's a bar for entry and for exit into the relationship. Your friend, you value that friendship. In this virtual world, it's really quite different. It's asynchronous. You throw something out there, and then later on you're going to get something back. It's disembodied. It's really only text-based. You don't get the nonverbal communication cues that you do when you're in person. It's really one to many participants. You're throwing it out there to, if not the whole world, a broad base of potential reactants to that. And those relationships that you have with those that that will be reacting have a relatively low bar for entry and exit. So you're much less reserved maybe on what you're willing to put out there or what they're willing to feed back. So this difference in real world versus virtual world communication, I think is important to keep in mind. It starts to have an impact on our youth's brain development because of their hypersensitivity to social feedback. Any parent of an adolescent knows this hypersensitivity and it can flash very quickly. In the social media world, the likes and the followers are direct feedbacks, both positive and negative, in a social feedback loop for our youth. Our advertisers tailor the ad content so that it capitalizes on the predisposition of our adolescents for peer influence. And increasingly in our AI dominated world, AI is going to pick up information about your child to have targeted AI recommended content to prioritize the messaging, whether that's advertising, whether that's recruitment or other efforts. And this affects youth's neurodevelopmental um, uh, growth. The scroll, our youth have difficulty disengaging and, creating a dependency upon constantly being tied to their phone. The lack of time limits, as I mentioned earlier, with 1 in 3 kids reporting use of social media after midnight on a school night. It interrupts schoolwork and sleep. The push notifications capitalize on youth's sensitivity to distraction. And I think importantly, what our youth and many adults don't recognize is that that data that we put out there is out there forever. And so social media's use and retention of data really exploits the lack of appreciation for long-term consequences for some of our youth. And this can affect future, school opportunities, future employment opportunities, other things that, again, this is a new technology. We need to be aware and recognize the benefits, but also the risks that it may represent for our adolescents and our younger youth. Now, our mental health impacts are starting to show up. Research shows that 12 to 15-year-olds who spend more than 3 hours a day on social media are twice the risk of depression, anxiety, and other poor mental outcomes. Studies have linked excessive social media use by adolescents to decreases in life satisfaction and starting to recognize that the social media use, or at least the technology use, does end up having an impact on the creation of neural pathways that studies are increasingly showing are comparable to addictions of drugs, alcohol, or other substances of abuse. Now, some of the information that we see from surveys, this is from the U.S. National Survey on Drug Use and Health. We see since that introduction of the cell phone, a dramatic increase in depressive episodes, particularly among females or young girls, with 27% reporting a depressive episode in the earlier parts of this decade, about 3 times greater for girls and boys. We also see non-fatal ER visits with self-harm that have dramatically increased over the course of this time period. As again, it's not a direct cause and effect, but it is an association, likely because of what individuals are exposed to through that technology and its doorway to the internet. Our suicide rates definitely went up predating the pandemic, and luckily they peaked during the pandemic, but they're still exceptionally high compared to where we were a decade and a half or 2 decades ago. We do know that limiting social media to 30 minutes a day over a 3-week period had an immediate and notable reduction in depression through one study that looked at adolescents that had depression and social media addiction. We know that there's a direct impact on sleep. The connections between poor or insufficient sleep and depression and social media is increasingly well documented. The poor sleep has been linked to altered neurologic development as well as suicidal thoughts and behaviors in adolescence. And to help ensure children get enough sleep, one action point is parents can agree with their child, and we'll get to some of the other opportunities that parents have to agree to screen-free time, at least 1 hour before bedtime, and to make sure that the devices kind of automatically lock, or maybe you're not even in the bedroom each time as your teen goes to sleep. There are developmental impacts. The brain development is especially susceptible to social pressure, peer opinions, peer comparisons, and this frequent social media use can be associated with distinct changes in the developing brain, affecting emotional learning, impulse control, and social behavior. Finally, here again, some survey-based indicators of those with currently diagnosed mental or behavioral health issues like depression or those without. Those with are less likely to be engaged with school, less likely to have contacts about problems, more likely to have missed school days, to be a bullying victim, or to have difficulty making friends. And again, the social media is not going to affect everyone the same way. This is not an infectious disease, but this is a new exposure for which kids will have different reactions depending upon what their exposure and what their activity level is. Let me pause for a second here. Make sure we're sharing adequately. Right. I think we're good.
Yep.
So let's delve in a little bit to what some of the research is starting to tell us. Um, this is from the National Health Interview Survey from 2021 to 2023. I'm going to share a little bit about the design of these so that people can understand and have confidence or concerns that we can discuss. It was an online survey of teenagers. They got parental permission to survey the teen from about 60% of parents that answered the phone or answered the survey. They gave permission for their teens to participate, and then about 46% of the teens did participate, which represented more than 1 in 4 responses. What we found in the National Health Interview Survey is that 50% of teens had 4 more hours of daily screen time. We had some racial differences with minority teens likely to have more than 4 hours, about 60%. 1 in 4 teens with 4 hours or more of screen time experienced self-reported anxiety or depression symptoms in the previous 2 weeks. So this is a survey of teens. 50% had more than 4 hours of screen time. Of those with more than 4 hours of screen time, the teen reported anxiety or depressive symptoms greater than 1 in 4 times in the previous 2 weeks. Teens in metropolitan areas and teens in families with lower parental education had higher screen times and thus higher levels of these anxiety or depression symptoms. Another survey that is a pilot for a future national longitudinal survey in Florida surveyed 11 to 13-year-olds. And what it found in these 11 to 13-year-olds is that more than 3/4, 78%, had their own smartphone, most with an associated data plan giving them access to the internet. Over half had their own tablet. Um, about half said they would rather spend time online than hang out with other people, their friends. And about half said they use technology to avoid feeling sad or to get relief from negative feelings themselves. Almost half said that agreed with the statement that I don't do things I'm supposed to do because I'm using the technology. And I think many parents probably can affiliate with that. 20%, 1 in 5, agreed with the statement that life often feels meaningless. And the current age requirements that have been uh, added to the social media accounts had little to no effect on kids' ability to access those platforms. They found ways to work around almost every barrier that the social media platforms had placed. And again, this was a survey of 11 to 13-year-olds. So again, I think this reflects some of the mental health burden that our teens are carrying. And the technology, while it may offer a short-term kind of relief, cumulatively may be offering more challenges. Now, this was a pilot survey that will go forward into a longitudinal aspect following these kids to see what the broader impact is. Again, some of their frequency of publicly posting, those that posted often and shared publicly online had a higher proportion of severe anxiety symptoms, mild or moderate anxiety symptoms, and you can see those that never post or never shared had less anxiety. Again, the interaction with the outside world in an unfiltered way potentially having an effect on kids' anxiety. Now, probably the strongest study that we have, and actually this was a 4-year longitudinal study. This was an adolescent longitudinal cohort looking at cognitive development. This study was in the Journal of the American Medical Association and actually was one of the top 20 requested studies from JAMA last year. But they enrolled about 4,200 kids, originally at an age of about 10. 40% of the families had an income less than 75,000. About a third had less than a college degree. About three-quarters were married. And what they studied, they looked at mental health outcomes, both those reported by the parent, internalized outcomes, the parent believing that their child was anxious or depressed, externalized outcomes, their child was aggressive or breaking rules. They also assessed children using a standardized questionnaire, looking at really three different outcomes of interest: social media addiction, mobile phone involvement, video game addiction. And they actually assessed also how much non-school screen time the kids involve themselves with, both on weekdays and on weekends. So this probably is our strongest longitudinal study for the outcomes of social media exposure or video game exposure. What they found with respect to social media is, and the higher score here is more addiction. They found really three groups. They found a low group, they found a high group, the orange, and they found an increasing group. And so this kind of stratifies the use type of social media. We'll get to the outcomes in a moment. They found mobile phone use, again, a high mobile phone use, increasing trajectory, and a low mobile phone use. And similarly for video games, they really had two groups. One is a higher group and a lower group. Now let's go to the outcomes for these three types: social media, mobile phone use, and video game use. They assessed standardized schedule for affective disorders, and they used a standardized survey of affective disorders and schizophrenia to measure suicidal outcome measures. Suicidal ideation, either the child is thinking about it, having a passive or non-specific, and with each successive step, it gets more serious, or actual suicidal behaviors, the most serious: preparatory action, interrupted attempt, an aborted attempt, or an actual suicide attempt. And what they found, and this is a little bit researchy, but I'll try to explain it. In the social media, for the very high group or the increasing group, the likelihood that the child or adolescent would think about suicide or actually take steps to move towards suicide, these are risk ratios. So if you were in the high peaking group, you were 64% more likely to actually think about suicide. Or if you were in the high peaking group for social media, you were three times more likely to actually move towards suicide. Again, so these are evidence of your most extreme outcome from depression. Social media had an increased risk of ideation and behavior. Mobile phone addiction had a higher likelihood of suicidal ideation or active behaviors. Video games had a slightly higher likelihood of suicidal ideation or behavior. Now, this is every parent's worst nightmare, but I raise this with you to share that these are from a longitudinal survey. The kids did not have these when they were enrolled at 10. By the time that they got to age 14, if they had these profiles of addictive behaviors for either social media, mobile phone use, or video games, they had increased likelihood for either to think about suicide or potentially even move forward with steps for suicide. So I think this is not to drive fear, but it's to drive the importance of being aware of what your child's social media or mobile phone use is. Now, in reaction to these statistics, we've had efforts both at the federal and state level to try to get the social media companies to take action. California, in September of 22, passed a law to have age-appropriate design go to regulate social media practices for users under age 18. The social media companies fight this as a restriction on their free speech. From my perspective, because of some of the addictive characteristics that were developed and are increasingly becoming made aware. Uh, our state efforts are appropriate, but our federal judiciary has put blockades in place. In March of 23, our Attorney General filed 3 lawsuits. Our Supreme Court denied TikTok's request to prevent the lawsuit from moving forward. Our legislature passed a Social Media Act. There have been multiple efforts on states' attorneys generals to try to move Meta to put safeguards in place. Um, the Supreme Court has consistently to date um, found that the First Amendment free speech right protects the companies for actually being uh, out and with the efforts. Again, President Biden signed a law that required the sale of TikTok, not because of protection efforts of our youth, but because of international concerns about the risk. This was finally sale was announced in 26. New York had enacted legislation focused on kids. The Justice Department had, filed lawsuits. Again, you see a number of actions, but almost all of these actions have been blocked because of the First Amendment efforts protecting free speech by these companies for just providing a platform that others put information on. So it's the platform is not the issue. It's the platform that provides access to what anybody can put out in terms of free speech that our kids are now exposed to because of that internet connection on our mobile phones. Again, this continues to roll through. I provide this that people can come back if you want to, when Katie posts it, to actually look at some of the specific court cases. We've had 25 states that have introduced legislation limiting or banning social media use by kids. 8 states, including Arkansas, ask for parental consent. All of these cases, again, have been challenged in court. And again, you see the First Amendment protection that the federal judiciary has actually kept states from being able to move into this space to protect our kids. Our state did put, with the governor's leadership and the legislative support, academic cell phone ban on public schools. So schools had to submit a plan. This has been a challenge. I think parents have a desire to be able, because of the fear of school violence, to be able to connect with their child, but at the same time, it's a distraction in the classroom from the goal of educating our children. So this is our first year of statewide deployment. I think we've had variable enforcement within schools. I think it's important for our pediatricians and our clinicians to engage with our parents on school boards and parent-teacher associations to make sure that we find the balance of protecting that educational space from disruption, while at the same time making sure that parents feel like they have the safety of their child in their school-based setting. My brother is a teacher in one of the local high schools or middle schools, and it has made a difference in the educational space. It's not a perfect solution, and in some of the conversations that I've had with school administrators and parents at parent teachers associations, and actually a school student representative at one, they said they didn't recognize how often they looked at their phone just to see what was happening during the school time within a classroom. So again, I think this is an opportunity. It's a step forward. We need to find the balance. And I would encourage parents to talk with their teen and to support protection of that educational time for the education that it's encouraged. Now, we do have other nations that have taken action. I mean, Australia enacted the world's first ban on social media for kids under age 16. France has passed a bill to ban social media for kids under 15. Spain and other countries are exploring future bans, trying to protect that younger adolescent age period from some of the basically international internet exposure that you can't control once you hand that child internet-based phone, or can't completely control. We are starting to see, and this I think will be the new frontier in terms of litigation, we're starting to see individual litigation against the social media companies for the addiction of their child. Earlier this week, February of 2026, there was a landmark lawsuit that started against Meta's Instagram and Google's YouTube in California that claim that those platforms deliberately offer an addiction potential and harm to children. A 20-year-old individual who goes by our initials KGM and two other plaintiffs have brought this lawsuit that the platforms have intentional addictive design and that they have targeted children. The social media companies are arguing that the First Amendment shields their liability. And Section 230, which is one of the federal judicial decisions that protects technology companies from liability of others that post on their platforms. Interestingly, TikTok and Snap, who were originally also named in this lawsuit, have settled to prevent kind of the exposure of the lawsuit for an undisclosed amount of money. Currently, we also have these ongoing litigation with 41 states suing Meta for collecting data on children under age 13 and design features and to addict children. We have 12 states that are suing TikTok for design features. Again, with increasing legal exposure, more documents are coming out that actually herald back to some of the tobacco strategies of addicting youth early so that they're lifelong users. We're increasingly seeing internal documents that suggest those same addiction strategies were utilized by some of the platforms in their development efforts. New Mexico is a state in isolation that is suing Meta for failing to protect children from online sexual exploitation. A sidebar here, I've had the opportunity to talk with the Arkansas State Police Division of Child Exploitation, and they receive about 500 reports a month of visual pictures, photographs from Arkansas of strangers that have convinced an adolescent or others to post something online. So this is, again, an exposure that I think we need to be aware of. We'll come to some of the opportunities for you to engage with your child here going forward. We did have a Surgeon General's advisory in 2023 that reviewed the evidence. Children are affected by social media in different ways. For some kids, it's a benefit, but for many kids, it's a risk. And so I think the parental and clinical and importantly, governmental obligations are to help make sure that we optimize the benefits and minimize the risks. I think probably the biggest risk is that internet connection that has your child be exposed to content that they can find or that seeks them out through some of the algorithms from the internet and their search engines. The frequency and intensity of social media use can be problematic for some kids. And, there are gaps in our understanding of what the mental health risks to children and adolescents are. We're growing that. But again, this is a new technology, and with any new technology, and before you would completely expose your child, we need to learn more and be fully engaged as we gain information. Immediate actions that the Surgeon General called for as policymakers that we just kind of reviewed have been somewhat thwarted to strengthen the safety standards. Technology companies to do better and more transparently assess the impacts of their products on children. We did have some efforts of Instagram to put age restrictions on it, but the age restrictions were easily circumvented by the teens that were smarter than the age restrictions. So again, we need to make sure that the technology efforts are true and effective, not just superficial to address some of the criticisms. Parents and caretakers can make plans in their households, and we'll touch on this in a few moments. And children and adolescents can adopt kind of healthy social media practices, not taking the phone and being on it after midnight and so forth. And our research community can prioritize future social media and youth research that supports the establishment of standards and helps evaluate best practices. Now, for our parents, I think frequently I was not aware how much control you actually do have the potential for. Um, you know, Both the Android and the iPhone have the ability to link your child's phone to your adult phone, and so that you can see the breakdown of screen time, the activity by different apps, the times of day when your child is using their phone. You can schedule times when the apps are not available. You can set time limits on your adult phone for how much time your child can spend on their phone. You can limit communication so that the child can only communicate those that are in their contact list. So that helps avoid stranger interfaces and what times they can have access to those contacts. You can block inappropriate content or applications. You can set a password so that only you can see the change in settings on your child's phone. And you can monitor your child's usage remotely, depending on the phone type. One of the important and for me unknown exposures that I gained from my conversations with the state police is one of the access points that kids have are old cell phones that are probably in the drawer beside your bed that when they can access them and connect to your Wi-Fi, it becomes a bypass for any of the restrictions that you think you may have put on your child's phone. An old cell phone tied to the internet that you're not aware of is an open access point again to your teens' availability on the internet. The other recommendation that the state police gave is to periodically change the Wi-Fi code on your internet at home so that all of the activity on that Wi-Fi suddenly becomes exposed because you have to have the new password to be able to get on the Wi-Fi. Again, this is a little bit like playing a detective, but again, you've got the entire internet now on your child's phone, and playing a detective can be, I think, an important way to figure out how your child is accessing, what they're accessing, and when they're accessing some of the information that's now readily available in their hand. I also think it's incredibly important to start a dialogue with your child. Discuss the importance of having healthy social media practices. Talk about blocking or reporting unwanted or inappropriate contact. Uh, Ask them to reach out to you when they see or experience harassment. Understanding what cyberbullying is so that they can understand the implications of that. And I think really importantly, educating our kids not to share personal information online. One of the things the state police shared with me is that many of our athletes in schools have a lot of their information publicly available, and this becomes a potential target for sextortion, where somebody can engage with that child, enter into what they think is a relationship that is age appropriate, but then it's really an online an adult online posing as an adolescent to engage with a relationship, and then when information or pictures are shared, it becomes an extortion mechanism. So again, the importance of talking with your children, talking about inappropriate content, inappropriate harassment, cyberbullying, and to make sure that they do not share personal information online. And also, I think it's important as a parent to demonstrate, how you use social media and the amount of time you spend on screens. It is an addiction that I think most of us will admit to privately. Whether we will admit to it publicly is a second issue. But to set a positive example, I think is really critically important. I think it's also important to watch for warning signs. Do you see disruptions in relationships of your teen, disruptions in schoolwork or extracurricular activities? Do you see mood changes that are significant, or eating habits that have changed, or deceptive behavior about how much a teen is online? All of these should be kind of warning signs to become more engaged, to become more observant, and potentially to reach out to help from either your teen's friends, your clinician, or others in your social network. Now, there's not a prescription for this, so I'm just going to provide you mine, which I share with others and now want to share with you. I think most importantly is, to have a strategy to engage your youth, to engage their friends, to engage their friends' parents, to socialize the issue, to educate folks on what we do and what we don't know, to participate, and I think importantly to protect. That cell phone, if connected to the internet, is the same thing that you can find on your computer or on your cell phone, they're exposed to everything that's on the internet. So this strategy to engage, socialize, educate, participate, and protect, I think, are important. I think it's important to have a family media plan that's discussed, that's agreed to, so that you're not in an argument day to day on how much or for what or where a child is going. Have age appropriate exposures. There are still cell phones that are sold that do not have internet access for our preteen youth. This is just like driving a car. There's going to be graduated autonomy and independence. We need to think about what your family media plan is for when and how that is going to happen. To have physical barriers to use, particularly during school time and during sleep time. Have an agreement that you're not going to carry the cell phone into the bedroom, that it's going to be not available, at least for our early teens. And then, as I just mentioned, to use the technical or technological solutions that are in your phones to appropriately limit both exposure and the amount of time that kids use these technologies. To balance times with and without devices. We have many of our kids, we have many of our parents that are on their device almost constantly. But to try to have some time without that device to avoid some of the addictive potential, to talk about and experience social media together. If you see something that is concerning on your phone, to share that with your teen because they probably have seen something equally concerning, and to be able to talk about that and to experience the social media, both opportunities, the fun things that we see in videos, but also the risks that may be exposed that we are less likely to actually share. To set a good example, to tailor and optimize your family's online experience, enjoy it for the benefits, share what is funny, but also recognize that your family's online experience gives opportunities for educational and for protective opportunities for engagement. Probably most important is to play zone defense. And this is probably not only important in the social media space, but also in every other growing adolescence. Talk with the parents of your kids' friends to the extent that you can have a zone defense where everybody is having similar types of expectations of their kids. Then you don't end up with one child when they go to or a child going to a different parent's house having a totally different set of expectations. This is difficult, but I think if you reach out and talk to the parents of your kids' friends, they're going to have some of the same challenges, some of the same fears, and probably some of the same observations that you have. And finally, as I mentioned, close off the escape routes. Our kids are incredibly able to close off and bypass things that we don't want them to do, but to be aware of those, like the Wi-Fi password change, like the old cell phone that's in your drawer, like the other aspects that again, our technological new world gives opportunities for access. There are a number of resources available for parents and caregivers. The American Psychological Association has a health advisory on social media use. Katie mentioned the American Academy of Pediatrics, but they have a Center of Excellence on social media and youth mental health. The Arkansas Department of Education has a good local tailored social media awareness campaign. And healthychildren.org offers materials to help a family create a media plan and to think through as a family how you want to approach this graduated autonomy that our kids want and deserve, but that we need to intentionally and explicitly put in place. Our Arkansas Center for Health Improvement has invested efforts on this that are available for you. We have several videos, including the topic overview, the sleep and quality associations. We have a blog post and some videos on the effects of learning and test scores on the suicide. Probably most importantly, which would have been helpful for me when I had a teenager, is a video of how to operationalize some of those mobile parental controls on your phone tied to your teen's phone. And again, additional links to local and national organizations. This is the landing page on our social media and youth mental health. The blog post on how to do your cell phone here on the bottom with other explainers, podcasts, additional resources. We try to keep these up to date with the most recently available pieces of information that we think would be helpful to you as parents, to our kids, and to clinicians across our state. We put out a weekly newsletter. Feel free to sign up for that. Anything in the health space, we try to stay on top of. And Katie, I'm glad to have been here with you today and look forward to any questions and answers that we might have from our viewing audience. Or if folks have questions later on, here's how you can connect with us at the Center for Health Improvement. So let me pause there. I'm going to stop sharing and be glad to take questions if you'll help me.
Thank you so much, Dr. Thompson. One of our first questions was if there is an easy guide where parents can learn how to apply monitoring tools and parental controls for their phone type. And when I saw that question, I came across a website called protectyoungeyes.com. Um, that has that exact thing, but
Mhm.
I don't know, Dr. Thompson, if you know of any other or if on ACI, if you have something like that already created.
So we created a video how to walk through both on the Android platform and on the Apple platform, how parents can activate and use their controls that are on their phones, how they link their child's phone first, and then how they can exercise those controls. The site that you mentioned, I think, probably may offer greater detail. I'm sure that on YouTube, there's been another parent that has gone through this. So I don't think there is a single magical source, but I would highly encourage parents to engage on the use of these tools because they are in your phone, but they are of no effect if you're not aware of how to use them, if you've not linked those with your child's phone. I have a friend who, actively watches how much time, her 14-year-old daughter now spends on different platforms, and has time limits of how long they can spend on those platforms. Now, I will share she frequently extends those time limits, but she knows that her child has maxed out on those time limits. So there's a way to kind of keep up with how much and when your child is using different apps. So I strongly encourage parents to familiarize yourself with those opportunities. I would not hide the fact from your child that you're going to use those opportunities because that'll elicit a backlash. And again, I think you want to have an agreement of expectations and then use the tools available for us to operationalize those expectations and gradually, gain freedom as we gain trust and knowledge of how to use this new technology.
Perfect. And then one other question was if there are any specific examples of low-tech phones or communication devices for younger teens or preteens, or if there are any specific apps for parental control and monitoring that you know of.
Sure. So on the first part of your question, there are still sold, not smartphones. So when you hear the term smartphone, that usually means internet accessible. There are still phones sold at Best Buy or electronic stores that have text capabilities, have phone capabilities, and have the ability to send pictures to those that you have in your contact list. So I would strongly encourage at least those adults or those parents that are considering phones for your preteens to think about starting off on that non-smartphone platform where you can text your child, you can call your child, they can send, potential pictures to their friends, but you're not crossing the valley of total internet exposure that you get when you offer your child a smartphone. So there are those. I will say the last time I looked at Best Buy, they only had one in stock. So I would say they're not a highly sought after product. But they are a strategy that parents can use, and that your smartphone can communicate with that not smartphone. It's not like you have to have both. The second part of your question, Katie, I lost it. Give me the second part one more time.
Yeah, that was if there are specific apps for parental monitoring, parental controls.
I think most of the monitoring and controls are built into your smartphone now. It's really a method of optimizing your knowledge of how to use those protections and controls. I'm not aware of a specific app, and if there is one out, be glad to take a look at it. I'm sure there are apps out there that um, do monitor your child's use. But again, I think the control is present in your smartphone's hand, not necessarily in another app.
Perfect. And I want to mention, because I was also Googling this about phones. So I put a link in the chat again for a blog post from Protect Young Eyes that goes through different options for the best phones for kids. There's one brand called Bark Phone, that seems to be the most popular. It looks like a regular iPhone, it's not that sort of lame flip phone from 2 decades ago. And then there's something called Gab. And so Gab it breaks it out by young kids like 5 to 12. It has a sort of smartwatch to keep kids safe. And then preteens, so 9 to 12, it has a recommended phone. And then it has a recommended phone for teens ages 13 to 18. And then there are other brands, but there is that link. And within the next couple of weeks, I'm going to work on a resource page for parents on the Arkansas AAP's website, with all of these links, to help parents. And that way you can share it out with your friends, and your family members who also are parents. And it'll just be sort of a one-stop shop for all of these questions and information that you may have. And we'll include all of AKI's really good resources, and also link to this webinar as well. So be on the lookout for that. We'll share that when it's ready on social media. And we'll hopefully share this webinar close to the end of this week. But I
Katie,
don't,
let me add
yes.
if I can. I just want to offer, parents encouragement. This is a new technology that was not here 20 years ago, so we should not, feel, badly at all that we don't understand it or that we're not on top of it. It is an opportunity, I think, for us to, benefit from the new technology, but with any new technology come risks, and we need to take steps to make sure that we protect our kids and educate our kids on how to become good social media users, to optimize the benefit, but protect against the risks.
Exactly. Thank you so much. And with that, we will wrap up. So thank you, Dr. Thompson. Thank you all for being here today. We hope that this was helpful, and helps you get sort of started on your journey of protecting your kids online. We will share this recording later on. And if you have any questions, please feel free to reach out. Thank you so much. We really appreciate it. Have a great day.
Thank you.